As we get older, many of us turn to supplements with the best of intentions. With age, our bodies absorb fewer nutrients from food, so taking supplements seems like the smart thing to do, right? But here's the shocking truth. What's meant to help you stay healthy can sometimes do the exact opposite. I kid you not. Some of the supplement combinations we're about to talk about can slowly chip away at your health, increasing your risk of organ damage, internal bleeding, and even heart attacks. And the worst part? Most seniors taking these combinations have no idea they're putting their health at risk. That's why this video is so important. In this video, we're going to uncover 7 popular supplements that seniors must never take together. These are common combinations that many people use every single day, often without realizing how dangerous they can be. Make sure you watch all the way to the end, because the last supplement combo we'll cover is one of the most common, and it can actually be quite dangerous if you're not careful. Before we dive in, please take a moment to hit that like button and subscribe to the channel. It really helps this video reach more people who need to hear this information. Alright, without further ado, let's get started. 1B complex plus vitamin B6. Let's start with one of the most common mistakes, taking a B complex supplement and an additional vitamin B6 supplement on top of it. Now here's the thing. Vitamin B6 is water-soluble, which means your body doesn't store it. You might think that means it's safe to take as much as you want, because your body will just flush out the excess, right? Wrong. When you take high doses of vitamin B6 over time, even though it's water-soluble, it can accumulate in your tissues and lead to a serious condition known as sensory neuropathy. That's nerve damage that often starts with tingling, burning, or numbness in the feet and legs and can progress to severe balance issues and muscle weakness, especially in the legs. And this isn't just speculation. Clinical studies back this up. According to the National Institutes of Health, long-term use of 500 milligrams or more of vitamin B6 per day can cause painful, progressive nerve damage. But even doses as low as 100 to 200 milligrams per day have been associated with neuropathy symptoms, especially in older adults with lower body mass and slower metabolism. A study published in the journal Neurology, Perry and Bredesen, 1985, found that patients who took high doses of vitamin B6 developed symptoms like loss of coordination, numbness, and foot drop, which in some cases took months to years to fully recover from, if at all. Now here's where it gets tricky. Most B-complex supplements already contain a good dose of vitamin B6. Add a separate B6 supplement on top of that, or take a fortified multivitamin with even more B6, and you can quickly exceed safe levels without even realizing it. And this isn't just about vitamin B6. The same danger exists if you take a multivitamin that contains vitamin E and then add an extra vitamin E supplement. Or if your multivitamin contains vitamin A and you're still taking a separate vitamin A complex on the side. All of these vitamins are fat-soluble, except B6, and they accumulate in the body, making it easier to exceed the recommended daily allowance, RDA, and tip into toxic territory. So the takeaway is simple. If you're taking a multivitamin or a B-complex supplement, be extremely careful about adding any single nutrient supplements on top of that. Unless your doctor has specifically tested your levels and recommended it, more is not better, especially when it comes to these powerful nutrients. 2. Iron plus vitamin C. At first glance, taking iron supplements with vitamin C might seem like a smart move. After all, vitamin C helps enhance the absorption of iron, especially non-heme iron found in plant-based foods and supplements. And yes, this combo is often recommended in younger individuals, or those who have iron deficiency anemia. But here's what many seniors don't realize. Iron supplements on their own can already be risky, and combining them with high doses of vitamin C, especially from potent natural sources like acerola cherry or Indian gooseberry, amla, can drastically boost iron absorption to levels that may become dangerous if your body doesn't actually need the extra iron. Why is this a problem? Because as we age, the body becomes less efficient at eliminating excess iron. Unlike some nutrients, we don't have a natural mechanism to easily get rid of iron, especially when it's coming from supplements rather than food. And excess iron doesn't just sit there harmlessly. It gets stored in organs like the liver, heart, and pancreas, where it can promote oxidative stress and cell damage. Research published in the American Journal of Clinical Nutrition has shown that excess iron accumulation is associated with increased risks of liver cirrhosis, heart disease, and even type 2 diabetes due to damage to the pancreas. In older adults, iron overload can also mimic or worsen symptoms of fatigue, joint pain, and cognitive decline, which can easily be mistaken for normal aging or other health conditions. That's why health experts generally recommend that seniors avoid iron supplements unless prescribed by a doctor based on blood work showing a true deficiency, such as low ferritin or hemoglobin levels. And here's where it gets risky. If you're already taking an iron supplement and pair it with a high-dose natural vitamin C supplement, like acerola cherry powder or Indian gooseberry extract, you could be supercharging iron absorption far beyond what your body can handle, and you'd never know unless you're getting tested. 3. Zinc plus copper. I honestly don't know why some supplement companies combine zinc and copper into one pill, because from a scientific standpoint, that's a bad idea. Here's why. Zinc and copper directly compete for absorption in the small intestine. They use the same transport pathways, and when you take them together, especially in a high zinc, low copper ratio, zinc wins and copper gets blocked. Now here's where it gets dangerous. Most people know about the benefits of zinc. It's great for immunity, healing, and even hormone support. But what many don't realize is that taking high doses of zinc for a long period of time without balancing it out can actually cause a copper deficiency. And you may be thinking, okay, but how bad could a little copper deficiency really be? Pretty bad, actually. Copper is essential for making red blood cells, maintaining healthy nerves, and supporting immune function. When your copper levels drop, it can lead to anemia that doesn't respond to iron, bone loss, weakened immune defenses, and even neurological issues like numbness, tingling, or difficulty walking. A study published in Blood, the Journal of the American Society of Hematology, showed that copper deficiency can mimic the symptoms of vitamin B12 deficiency, including irreversible nerve damage if not caught in time. And here's what's scary. Long-term high zinc intake is one of the most common causes of copper deficiency, especially among seniors who are supplementing for immune health. So, what's the right approach? If you're taking a zinc supplement, especially doses above 25 milligrams per day, make sure you're also getting enough copper, but not at the same time. Space them out by several hours. Take zinc in the morning and copper in the evening, or vice versa. And always aim for a balanced ratio. Most experts recommend around 8 to 15 milligrams of zinc for every 1 milligram of copper as a general guideline. 4. Niacin, vitamin B3, plus cholesterol meds. While not all supplements interact badly with medications, niacin, also known as vitamin B3, is one you definitely want to be careful with, especially if you're taking cholesterol-lowering drugs like statins. Now, niacin isn't just a regular B vitamin. It's actually been used in high doses to help lower LDL, bad cholesterol, and raise HDL, good cholesterol. Sounds helpful, right? But here's the problem. When you combine high-dose niacin supplements with cholesterol meds, particularly statins like simvastatin, atorvastatin, or rosuvastatin, you increase your risk of serious side effects, especially liver damage and muscle breakdown. According to the Mayo Clinic and research published in the New England Journal of Medicine, this combo has been linked to a higher chance of myopathy, a painful muscle condition, and in some cases, a rare but life-threatening muscle breakdown called rhabdomyolysis, which can lead to kidney failure. It also puts extra strain on the liver. Both niacin and statins are processed by the liver, and taking them together can elevate liver enzymes to dangerous levels, even if you don't feel any symptoms at first. And here's the catch. Niacin in food or in small amounts from multivitamins is usually safe, but the risk spikes when seniors take flush-free or extended-release niacin supplements marketed for cholesterol or heart health. These often contain doses far beyond the daily recommended amount and should never be taken without close medical supervision, especially alongside prescription cholesterol drugs. 5. Fish oil plus ginkgo biloba. At first glance, both fish oil and ginkgo biloba offer appealing health benefits. Fish oil is well known for its heart-healthy omega-3 fatty acids that help reduce inflammation and support cardiovascular health, while ginkgo biloba is celebrated for improving circulation and cognitive function. However, both of these supplements have blood-thinning properties. The omega-3 fatty acids in fish oil help lower triglycerides and reduce inflammation, but they also inhibit platelet aggregation, which makes it harder for your blood to clot. Similarly, ginkgo biloba is known to enhance blood flow while also carrying antiplatelet effects. When taken together, their combined ability to thin the blood can significantly increase the risk of bleeding complications. This is particularly concerning for seniors whose bodies may already experience reduced healing capacity and less efficient clotting mechanisms, potentially leading to dangerous internal bleeding or even hemorrhagic events such as strokes. As always, it is crucial to consult with your healthcare provider before combining such supplements, especially if you are also on prescription medications like aspirin, warfarin, or other blood thinners. Calcium and magnesium. You may not think that taking calcium and magnesium supplements together could lead to any real issues. After all, both are essential minerals. But here's the catch. Calcium actually inhibits magnesium absorption when taken at the same time. And for many seniors who rely on magnesium to manage serious issues like heart palpitations, high blood pressure, poor sleep, and muscle cramps, anything that interferes with magnesium absorption can be a real problem. Magnesium plays a critical role in maintaining normal heart rhythm, supporting muscle and nerve function, and keeping blood pressure in check. So, when calcium is taken alongside magnesium, especially in high doses, it can reduce the body's ability to absorb magnesium efficiently. This becomes particularly risky if you're already low in magnesium or are dealing with symptoms like irregular heartbeat, muscle spasms, or restless sleep. In some cases, this imbalance can literally throw your heart rhythm into chaos, something no one wants to mess with, especially in the senior years when cardiovascular health becomes even more delicate. That's why it's generally recommended that seniors get their calcium from food sources like leafy greens, almonds, and dairy products, unless a doctor specifically advises otherwise. And if calcium supplementation is necessary, it's best to take it separately from magnesium, several hours apart, to reduce the risk of absorption issues. This simple timing adjustment can make a huge difference in how well your body utilizes both minerals and can help you avoid unpleasant and potentially dangerous side effects down the line. Vitamin D plus calcium. Taking high doses of vitamin D along with calcium is, without a doubt, one of the worst supplement combinations you can make, especially for seniors. And here's the thing. It doesn't matter whether you take them together or separately. When consumed in excess, vitamin D and calcium can work together in a harmful way, drastically increasing your risk of developing kidney stones, arterial calcification, atherosclerosis, and even heart attacks. Why does this happen? Vitamin D enhances calcium absorption in the gut, which sounds like a good thing, until your body is flooded with too much calcium that has nowhere to go. Without the right balance of nutrients, especially vitamin K2, that calcium can end up depositing in your soft tissues, like your arteries and kidneys, instead of your bones where it belongs. This calcium buildup can stiffen your arteries, raise your blood pressure, and eventually lead to serious cardiovascular events. And that's why it's absolutely essential to pair vitamin D with the right amount of vitamin K2, which acts like a traffic controller for calcium. Vitamin K2 directs calcium to your bones and teeth while keeping it out of places it shouldn't be, like your arteries and organs. Without K2, taking high doses of D and calcium is like stepping on the gas with no brakes. It can lead to long-term damage. And here's another tip. If you're already getting enough calcium through your diet, from foods like dairy, leafy greens, almonds, or tofu, you may not need a calcium supplement at all. In fact, for many seniors, it's safer and more beneficial to focus on vitamin D3 with K2 and magnesium, which support bone health and calcium metabolism without the risks that come with over-supplementing calcium. And there you have it. 7 popular supplement combinations that seniors should never take together. Remember, just because something is natural or over-the-counter doesn't mean it's automatically safe. Always consult your healthcare provider before adding any new supplement to your routine, especially if you're already on medications or managing chronic conditions. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more eye-opening and informative health videos like this one. Thanks for watching and take care of yourself.